exciting episode of Health Check, where we bring you specialists from different fields to discuss your health from your top of your head to the sole of your feet. These guys come through in a great way. Today we talk about this organ called the meninges. And when the meninges get inflamed, meningitis. You might have heard this word severally everywhere, but today we break it down. What does it really mean and how can you be able to cope or live with it? Let's find out. Joining me in studio are two great people. We start with the lady. Hello.
Hello.
Karibu sana.
Thank you.
This is Health Check. I hope unasikia uko nyumbani.
Kabisa.
Oh, very good. Dr. Christine Chege. And what do you practice?
I'm a pediatrician, trained in pediatric infectious diseases.
What does that mean? Just for someone who's like...
Just break it down. Pediatric means children. Infectious is the illnesses that are caused by bacteria, viruses, that can be passed on from one person to another.
Awesome.
Yeah.
Awesome. And back again, making his second time debut. Is like ululations. Our neurologist in the building, Dr. Kinoti Chege. Thank you for joining us again.
Asante sana, Kelly. I'm really happy to be back.
Absolutely. And this particular thing we're talking about this day, can you just break down what is meningitis and the types maybe that they're in?
Excellent. Now, meningitis, simply put, refers to inflammation of the meninges. Now, meninges may not be something that most people know what that is. So we can start by saying that most organs in the body have some kind of package or some kind of covering on them. They don't just float in the body, moving around as you walk around. They are restricted by something.
Okay.
Like where you put bread in a paper bag. So the brain is covered by these linings and tissues called meninges. So that is a protective covering of the brain. Now sometimes you may get inflammation or swelling happening to those coverings of the brain. And when that happens, when there's inflammation of the meninges, then that situation will be called meningitis.
Okay.
Now there are around 5 different types of it. You may have infections by viruses, so that would be a viral meningitis. You may have infections by bacteria, so that would be bacterial meningitis. You may have infections by fungi, that would be a fungal meningitis. You may have meningitis which has been caused by parasites. There are various things, you go swimming and some things enter through your nose, and that may be a parasitic meningitis. Wow. And you may have a septic meningitis which is not caused by any infection by something, but by various other things, various chemicals or your immune system or other things.
Okay.
So those are all the types of this meningitis. And that is the organ that lines the brain. Okay,
Dr. Christine, maybe in children, what are some of the most cases you've seen, maybe based on some of the explanations that is given?
Okay, in children, basically the same organisms that he has mentioned can cause meningitis in children. The difference now comes in how the children will present. So for example, the newborns and the neonates. When I say neonates, I mean any child who is below 1 month.
Neonate.
Neonate.
Okay.
That is something you can use to be scaring people out there. Tell them, I've seen a neonate. And they'll watch a kukubeba hivi hivi. So anyway, the neonates. So the neonates, most of the times when they are ill, they will not manifest in the same way. So that is one difference. And I believe anyway, I can take the chance to talk about how the neonate would manifest when they have meningitis, because it is very easy for people to miss. So one of the key symptoms of a sick neonate who may have meningitis or any other infection close to meningitis, because in neonates, their immune system is not very mature. So they will not specifically behave like an adult, when he will tell us, who has meningitis. So for the neonate, the key sign is mtoto wangu anakaa hivi. Is just lethargic, is just unhappy, and cannot breastfeed. That is a very key sign that there is something seriously wrong with that child and needs to be investigated. And meningitis can present in that way. Other children will just be irritable and cry. And one characteristic cry is what we call a high-pitched cry. Just think of, most mothers, not most, all, This is instinct.
Okay.
It is not even something that you are taught in the hospital before you leave. Oh, mtoto akilia na volume hii na hii, kilia na bass anasema hivi. It's inside you. There's a cry of pain. There's a there's a cry of hunger. There's a cry of diaper, and there's a cry of nataka tu kusumbua.
Yeah.
But there's a cry of something is wrong, and that is a high pitched cry, and you will know. So it's not necessarily that all children will have a high-pitched cry, but a high-pitched cry in a newborn who is also having other signs like being unhappy, not being able to breastfeed is one key pointer. Other than that, the newborn or the neonate may have fever. And now a difference now, because we are talking of the newborn, is that they may not necessarily have fever, but they may have low temperature.
Okay.
As in below the normal temperature.
Okay.
So it can, because they are, the temperature system is actually controlled in the brain. And as you say, the meninges are coverings of the brain.
Yes.
So anyway, so that can be a sign. And then now the other sign of meningitis, the newborns or the neonates have this this thing here. Let me just point here.
Oh yeah, the one where they breathe. Apparently you're not supposed to touch.
In fact, I'm so glad you have said where they breathe. Because
do
I
they
have
actually
seen,
breathe there?
No.
Oh,
and it is very dangerous. It is very dangerous to think that a baby breathes through there, because I have seen a choking baby and somebody was actually trying to blow on. It's called the anterior fontanelle.
But that's what they say you should do,
no,
apparently.
No. And I'll just digress a little bit
go
and
for
say that people should learn first aid. And now for free, first aid does not involve breathing on that thing or patting it. That is just a normal, because you have your skull bones.
Yes.
But because they are not closed, because your brain needs to grow as a baby, there is a gap.
Okay.
So it closes as you grow.
Okay.
So there is nothing really there. There is just the scalp. The skin of the head is called the scalp. Another word you can learn.
Absolutely. I think the Lord is preparing me for this.
He's really preparing you for something.
Hallelujah. Thank you, Jesus.
Yeah. So when you so touching or blowing on that thing has nothing. You are just wasting your time. And if you see your baby with that swollen fontanelle,
yes,
that could be a sign of meningitis.
Okay.
And please do not pat it. Do not blow on it. Just go to hospital.
I'm coming to you to find out where these children could have gotten the parasites or the viruses of all that. But Daktari, even when you talk about the types, there are various layers of the meninges. Is that where also we get different names for different kinds of inflammation?
Yes, mostly it's going to be the inner layer, which is really the soft one, which is directly in intimate contact with the brain. The outermost layer is really rough. It's just next to the bone of the skull. So that layer is not so much involved in this process. The inner layers are the ones which have got a lot of blood supply, a lot of fluid is passing there, and therefore those layers are the ones that will be exposed to infection.
Okay. You've talked about causes. We've talked about viruses, parasites. Is there like a major cause, especially in this nation? And as you respond to that, I want to welcome your questions. They better start coming, because I told you I've paid consultation to a neurologist and a pediatrician in the building specializing in pediatric infectious diseases. So go ahead, 22232 is that line. Send in all the questions you might have. We'll be opening the call lines shortly. Let's talk about that. Is there a specific one that maybe it's prevalent in Kenya? And also be telling us in the kids, where are they getting this? Mothers, they don't even touch anyone. Mtoto wangu hakupendi. So where do they get the viruses and all that?
Yes, now that's an excellent question. Now the most common meningitis that you'll find will be divided into either bacterial or viral causes.
Okay.
The bacteria that one sees a lot are going to be strep pneumo, which causes that kind of meningitis. You'll also get another meningococcal meningitis, which is really bad and causes death very fast.
Wow.
Then you may get Haemophilus in the kind of meningitis. Those three are really top.
Okay.
But one group which is often overlooked, because really most of the time there's nothing much done for it, are the viral causes.
Like coronavirus?
Well, the coronavirus, we are not sure if it causes meningitis,
Okay.
but there are viruses related to it,
Okay.
which can also enter and cause some inflammation. Now, these ones are often self-limiting. They give you some mild headache, and they make you have a bit of fever, and you feel bad for a few days. But often they recover without any major problems. So actually their real impact is not very well studied as opposed to the bacterial ones.
Okay.
Because the bacterial ones you must treat as an emergency very quickly. But the viral ones, in a person who is immunocompetent, whose immunity is not compromised, almost always many of them will be really mild. Some can be really bad. If you get, say, for example, something like herpetic meningitis.
Yes.
You know, herpes simplex, the virus which causes some sores to form on the corner of the mouth.
Okay,
here.
wait. Is there a difference between that and the other herpes? Or it's all the same
Both are
family?
herpes simplex, but
Okay.
one is type 1, the other one is type,
Type 2. So this is type, the
So
one you get on your
the one, the innocent one, let's call it the
The
innocent.
innocent and the guilty one.
will be type 1.
Yeah, what
The other one
a
which
shame.
is less innocent is type 2.
Okay.
Now type 2, because of its location in the view of this lack of innocence,
Yes.
is actually likely to
Yeah, in
be-
fact,
to
I'll
affect
talk a little bit about,
About
that
it.
one.
Okay.
about
Yes.
type 2. Yes.
Yeah.
So the common ones will be bacterial and viral.
Okay.
But the others also, you know, you can actually divide meningitis into two broad kind of time parameters.
Okay.
There is acute, which comes pretty sudden and is explosive. And the time course is within days, and within a week or two, either you have gone or you have recovered. That is acute.
Wow.
Then there's the chronic one, which comes slowly. You begin to feel unwell. It takes weeks and weeks. And eventually it's come to be, you are diagnosed with a chronic meningitis. Now the chronic type is commoner in a person who is immunosuppressed.
Okay.
And you know the common kind of immunosuppression we have is due to HIV, although there are other reasons for immunosuppression,
Absolutely.
including if a person has used steroids for a long time for various conditions, if a person is on chemotherapy, all that kind of thing. So when you are immunosuppressed, you get the chronic type of meningitis. And that one is often going to be either due to TB sometimes, or due to various fungi like cryptococcal meningitis. Those two are common in that kind of grouping.
Okay.
But in the population, in the people are not immunosuppressed out in the community, the one of concern will be the bacterial ones.
Okay.
Where you're going to talk about the strep, the meningococcus, and the Haemophilus type.
When we come back to you, be telling us about the symptoms. What are people feeling when they come to your office or when they go to a general practitioner and they have to be referred to you? But now, for the children, what's happening? Where are they getting it from?
Let us start with the HSV.
Yes.
He has talked about, and HSV stands for herpes simplex virus.
Okay.
So he has told us about, Dr. Kinoti has told us about type 1,
Yes.
which is normally the one that you have a cold sore.
I saw very ugly.
Yeah, caused by that innocent. Let me use quotes.
Okay.
Now we have the type 2, which is also called the genital herpes.
Yes.
So what happens, because I know you're wondering, you're a pediatrician, what's the connection here? If a mother, say for example, has a genital herpes, and she delivers, and the baby, of course, will get into contact
Yes.
with that herpes. So when the baby is born, because remember I said at the beginning that babies have an immature immune system, they are not very well able to fight infections off, or to even wall off infections. So they get very severe disease from even a simple innocent thing.
Yes.
So HSV2 can cause, let me call it a meningoencephalitis. That means not only will it infect the meninges, which we said are the linings of the brain and the spinal cord, but will also cause inflammation of the brain itself.
Wow.
That is a very serious meningitis. So meningoencephalitis can be caused by HSV2.
Okay.
And this is not a hopeless situation. This just means that mothers should take their antenatal care very, very seriously. And any sores or any kind of pimples that you see in genital regions, they should be checked out.
Wow.
Because these are infants who can even be delivered through cesarean section. Yeah. Because genital herpes is actually quite difficult to treat, and some of the treatments might be toxic to give a pregnant mother.
Okay.
So, so that I can talk a little bit about some of the bacteria, because they may manifest differently or rather I continue with the symptoms
Sure.
of meningitis.
Yes.
So for the children who are a little older, they were going to talk about headache.
Yes.
Yeah. So headache, and then something we call photophobia. Photophobia is you just put two words together. Photo meaning light, phobia meaning fear fear of light. So when you look at the light and you have a severe headache, that can be a sign of meningitis, but not in isolation.
That's true.
You have to put in other things like a stiff neck. Yeah, can be a sign of, but this is in the older children.
What age? Maybe.
Any child who can be able to report they have a headache.
is
I
an
believe
okay.
a 3-year-old can be able to tell you they have a headache. And then stiff neck is you as a doctor to actually try and flex, the neck of the, and then you see it's actually stiff. Yeah, but not every stiff neck is a meningitis, because severe tonsillitis, which is common in children, can also come with a stiff neck or just sleeping badly.
Perhaps, yeah.
Yes, so people relax.
Okay.
I'll let Daktari
Thank
continue.
you. In adults, what happens? What are the symptoms they are presenting?
Actually, it's pretty similar, like what Daktari has said, in the older children. You know, the older children and adults is a spectrum.
Yes.
There's no point when you say this is an adult. Although we use legally, you can say over 18,
Over
you can
18,
vote,
okay.
and there's,
Okay.
but there's no day that you instantly turn like this and say, yesterday you are a child, today you are an adult.
Okay.
So it's a spectrum of change.
Yeah, I've been through that.
So the presentation starts from what Daktari has said, headache, pain in the neck, feeling drowsy, feeling weak. A few days even before you get all those things, you might just feel generally unwell. You know, then you feel when you have a bad flu, you feel your joints are aching, you lose appetite, you feel you don't want anything. That one is non-specific. And you cannot really diagnose meningitis at that stage.
Okay.
Now it really sets in when you start to now get vomiting, light is hurting you, you have got a very bad headache. Then eventually once things progress, you start getting confused, you start getting drowsy, and you cannot be woken up easily. And then you can even progress into a coma and even convulsion sometimes.
Wow.
So it's a whole spectrum of presentation, starting from very mild, where sometimes it's very difficult to know for sure that this is meningitis, to very serious where you're even in a coma. And it's for the acute meningitis, that takes hours.
Okay.
Yeah.
And that's why it has to be treated very quickly, because from the time it starts, the time it becomes very serious, especially for the meningococcal type, it really takes, it's a very quick one.
What will someone present, or what will someone be feeling? Because I know many Kenyans are just like, Mimi, kwenda kwa daktari. You know, by the time someone is actually willing to come, it's like already, T minus 20 seconds before they, what are some of the things that you can look out for? Maybe you can be able to have that conversation.
I think for the people out there, the thing which is critical, because the patient or the family often cannot diagnose meningitis on themselves.
Absolutely not.
There are those clinical signs which a doctor or someone experienced with meningitis has to elicit. But for the people out there, really, what you can say is that if you develop fever, if you develop severe headache, if you find the light is hurting you, sometimes with vomiting, and it's something which comes on and builds up pretty fast, then please go to hospital and have it checked if it's meningitis. Could be something different. Even malaria sometimes presents in such a
or just
way.
eye problems.
Yes, anything.
Yeah.
But if you get those things, don't stay with them and say, I'm waiting for tomorrow.
Okay.
Let me just take some paracetamol and wait and see if I'll get better. Tomorrow may be late. So when you get fever, vomiting, severe headache, some pain maybe in your neck, you find the person is beginning to show confusion and maybe some drowsiness, please move them to hospital as quickly as possible.
Okay. Yes, this is a conversation we're having on Health Check today with our neurologist, Dr. Kinoti Ndege, and our pediatric infectious disease specialist and pediatrician, Dr. Christine Chege. And the conversation is on meningitis. This is that layer that covers the brain, and it can get inflamed for one reason or another. And mostly we've talked about various infections. We've talked about bacteria. We've talked about viruses. And that's the conversation we're having. In children as well, it's a huge conversation. So 22232 is our text line. Go ahead, start sending in your questions. Share this video. If you're watching us on Facebook, your friends need to be seeing this. So go ahead, share it with them. Let them get this information. As we do that, what are the risk factors for meningitis?
Okay, let me say, because I know many people are listening are mothers, and mothers are very protective of their children, and fathers as well. Fathers not so much, but mothers, they are there waiting, and then tomorrow you'll see them coming to hospital, mtoto wangu ako na meningitis, nini. So let's say the risk factors that you can avoid, and then there are some that you can't really avoid. because with bacteria, they are all over, they are around us.
Okay.
But one risk factor for meningitis, and specifically for meningococcal meningitis, is overcrowding. Because meningococcal meningitis, which Dr. said is serious and the one that builds up pretty fast and with one of the highest mortalities, it spreads very fast in crowded places. And some of the crowded places we have are our boarding schools,
Wow.
our universities, in the hostels. Now, for younger children with a low immunity, that can be a risk factor. And that is why we have vaccines, because vaccines are available for this main bacteria. For strep pneumo, the vaccine is actually given to all children in Kenya.
It's one of those injections that Nenda injection.
Yeah, Nizo. In fact, it's the first 3.
Okay.
It's given to every child in Kenya for free. So that is good. So the other one, he talked about one called Haemophilus influenza type B, is also given for free to all the children. So we've virtually eliminated those causes of meningitis, except in a small population of people who don't have a very good immunity. Say, for example, the people with sickle cell disease. They do not have very good immunity against some bacteria like like strep pneumo or even meningitis. So those ones need to be watched very cautiously, and they may need to get boosters for their vaccines.
Okay.
Then I want to talk about meningococcal meningitis. It has a vaccine, but it is not routine.
Okay.
This is a vaccine that you have to pay for. And it's given as early as 10 months of age.
Okay.
So that vaccine is available, but not in the government. But if you know, sometimes people say vaccines are expensive, but if some of us have cars and we really insure them, even if you'll not get an accident, you make sure insurance has been paid for. I wish the police would be checking vaccination cards the way they check the stickers out there in traffic.
Very important.
People would really take vaccination against things like meningitis very seriously.
And so after 10 months, is there a chance for the child to get it?
So after 10 months, if you give it at 10 months, you'll have to repeat, because the immune system did not quite... you'll have to repeat after 1 year.
Okay.
But if you give it after 1 year, 1 dose will protect you for life.
Okay.
So everybody should get that meningococcal vaccine.
Okay.
Yeah.
Okay, absolutely. Even as we discussed that, you've talked about the diagnosis, maybe some of the more detailed things, like when someone actually comes and now they've been referred to you, what are some of the things you look at?
Okay, so the diagnostic process, yes, there are various signs. But before I get that, maybe there's something which I hold particularly important, which I would like to mention before we go to that.
Yes, sir.
There's a growing movement across the world of people who are opposed to vaccination. And it's also taking root in this country. And they have been raising various questions about vaccines and trying to put fear into the population about it. I really would like to advise and to encourage people to keep on vaccinating, because that is the best way to prevent from these serious diseases. Vaccinations are medical products, just like any other medical thing. And therefore they may have side effects, just like any medication may have side effects. But that doesn't mean that because of those side effects that we want to avoid giving them to people, because the side effects are minor and they pass. But the disease may cause death or serious disability, because meningitis doesn't only cause death.
Yeah, exactly.
Can cause deafness, can cause epilepsy to develop, can cause blindness, can cause paralysis. So besides death, it causes many other long-term and serious conditions. So I really wish to emphasize that this movement, which is trying to put fear into people about various vaccinations, really should be discouraged, in my opinion.
Thank you so much for that.
The other thing, back to the risk factors, let's also talk about environmental factors.
Yes.
Yeah.
Because when I was younger, we used to hear of outbreaks of meningitis occurring, and it used to be a public health emergency.
Yeah.
These days, it no longer happens as frequently as it was happening in those days because of improved environmental things, including cleaner environment, especially now at this time of COVID.
Yeah.
I think we are going to get
Things are
very
so
few
clean.
infections.
Yeah.
Everyone is cleaning hands,
That's
using
true.
masks.
Yeah.
So it's not just going to prevent you from getting COVID-19.
Yes.
They'll also prevent you from getting all these other infections which are transmitted in the same way. Because meningitis also is transmitted the same way. It enters through the nose and settles there and goes up into the brain and various ways. So actually this is a good thing in a way, that all these other infections will probably come down more than they would have been without people being conscious about their environment.
Absolutely.
Now the presentation, when the patient comes to us and explains that they have this very severe headache, light is hurting their eyes, they are feeling drowsy and lethargic, and they have no appetite, and they're even vomiting, then that raises a suspicion of meningitis. Now, two things need to be checked. One of them is to ensure that the patient, to really confirm that there's inflammation of the meninges, you want to look at the stiffness of the neck, because when you flex, when you move the neck forward, that causes movement of the spinal cord up and down and traction or extension of the meninges. And that elicits a lot of pain when there's inflammation. So the patient will unconsciously even try to resist that pain. So the neck will be very stiff. So when you try to move it forward like this, you find it can't go much. It just goes for a very short while. And various other maneuvers also done with the legs to kind of get the same kind of reaction. So the doctor will do that and will confirm that there's indeed inflammation of the meninges, or at least something causing meningism, which is some stiffness around the spine. Now, once you do that, you've got to go ahead and do the confirmatory test. And the one confirmatory test which is really crucial is the lumbar puncture, where you get
the lumbar vertebrae.
You get the spinal
puncture.
Spinal puncture.
But is it the lumbar that we're talking about, like the vertebrae?
The vertebrae in the lumbar spine, the lower part of your spine. That place has got enough openings, and the spinal cord is not there. So you're able to put a needle in there and get the fluid.
Dr. We had a whole spine here last week, actually. It was set up over here. That's what we talked about in last week's episode. So if you didn't check it out about your spine health, go ahead and check it out on YouTube.
Exactly. So in that spine, there's a space where you can put in a needle and get in some fluid. So that is what is called a spinal tap. So you get the fluid, and that fluid circulates all the way from the head down into the spine, from the brain down around the spinal cord down into the spine. So if you get that fluid, you're able to analyze it for bacteria and for various other signs of infection, and it's confirmatory. If it's positive for meningitis, then you know that's meningitis. If it's negative, then you know the meningitis will be unlikely. And but sometimes for even this meningococcal meningitis or these other infectious meningitis, which progress very quick, you need to do that test very quickly as soon as the patient presents, because you need to start giving the antibiotics quickly. But then if you delay giving the antibiotics also as you're doing this test, that causes trouble. So they need to be done almost simultaneously. You do the tap and start the antibiotics immediately so that there's no delay.
How long does it take? You know, we go to test so many times. How long does the test take? Like
the spinal tap?
Yeah.
The spinal tap depends on the experience of the fellow who is doing it. I remember when I was a student, I would really struggle with the patient, because you start practicing these things when you're a student. So you really struggle and try to get the person to bend forward.
And mostly it's the positioning.
The position is really difficult, and the patient is so scared, so he keeps moving. So it can take half an hour or more in that situation. But if you're able to calm the patient down, and you have done many of them,
or a small baby,
and you have got the experience with it, just a few minutes, a couple of minutes, and the whole thing is out.
Wow. For children,
yes.
What is this diagnosis? What do you do? Is it this exact same thing?
Yeah, it's a spinal tap. So the difference is the fact that the child is small, so they will not resist much. And then they tend to be a little bit more flexible than the adult. So because the technique is you must make somebody chin touch the knees.
So it's you bend kabisa.
Yes, like a back. Yes, you're supposed to. So that now in here is where I put my needle in.
Oh my.
And then it's not as bad as it sounds.
I know, I'm just like
actually when somebody is an experienced person just goes in one touch, and if you are supposed to see clear fluid, that's how the spinal fluid looks like.
Yes, that's what I was asking, because I thought you have to go, you put it where, and then you see.
The spinal fluid looks like water if it's clear. But if in most cases of bacterial meningitis, especially, it will be cloudy, like whitish. And that can even guide you. That here we are really dealing with. So that is a key and crucial test. Then you take it to the lab. There are various things you test. There are tests that you can do in a few minutes. If you can actually be able to stain the cells, and you might see even like the Neisseria meningitis cells, meningococcal cells, you might see them. You can do some biochemical tests, and you see if the glucose is low or high, the proteins, those parameters. they can actually, even before the culture, before you actually grow the bacteria, you can be able to make a diagnosis. But that should not delay your treatment.
Okay.
Because the beauty is the treatment of meningitis is treated with very simple antibiotics.
And that's where
Our
we were
penicillins,
going to.
yes, our penicillins, especially, in fact, the worst bacteria like that Neisseria, it responds very, very well to penicillins. Meningococcal responds very well to very cheap penicillins available in all our hospitals in Kenya, everywhere.
Wow.
They have the treatment for meningitis.
Okay.
Yeah.
And that's where we were going to, the treatment. So you can still continue.
So,
is that it?
I really like, I like us to focus on bacterial meningitis.
Sure.
Because bacterial meningitis is actually the killer and is actually the thing that you can treat.
Yes.
You see, like Daktari told us, viral meningitis, you have no control over it. The body just fights it or kills you. But most of the time, it fights you. Now, bacterial meningitis can kill you if mishandled. And yet we've said vaccines are available.
Yes.
And if the vaccines, maybe you are not vaccinated, but you got it, treatment is available if you present yourself early. And if you go and, you know, another thing I have seen with Kenyans, they come and they hide their symptoms. Unfortunately, especially in this COVID-19 era, people are more scared of quarantine than dying. I'm telling you for real. So people come, they hide, they say this, that. The beauty with children, even if the parent gives you the wrong information,
The child will say.
no, they won't say. You will see it.
You'll see it.
You will see that thing bulging here, the fontanelle.
Okay.
You will see the child being unresponsive. You can actually pick very many things from a child. I prefer treating children than adults because adults want sick coughs, they want to exaggerate, they want to help you, they have checked Google, you
They
know. They know a lot. But the child, I mean, you
That's why
check.
children are going to go to heaven first because they
For
are with
sure.
a heart like a
In
child.
fact, then they will just, the doors will just open. So we are back to treatment
Yes,
of
please.
meningitis.
Yes.
So once you've made your diagnosis, you just start as soon as possible. You start the treatment. And most treatment will go for more than 10 days. So even if you're feeling better, you have no right to start asking your doctor for a discharge. Because remember, the antibiotics have to penetrate the meninges. They have to go in there for a long duration of time to actually sterilize the meninges, like remove all, they don't even leave one bacteria in there. That is one of the infections that you have to eliminate completely. Don't say tutoe ingine kidogo, then enda ukakunywa amoxil nyumbani. It is not like that. You have to exactly go and get everything out. So you treat for at least 10 days or even more. Na ile ingine tulisema ya HSV herpes, that one actually goes for 21 days or more.
Okay.
Yeah.
For treatment for you, copy paste?
Yeah, it's largely that. That's what Daktari has said. For bacterial meningitis, you're going to use the appropriate antibiotics. Some of them Daktari has mentioned here. For the viral meningitis, if there's an antiviral that exists, like acyclovir or valacyclovir or various whatever for the herpetic type, you use that one. Then maybe we can talk about the chronic types.
Absolutely.
You know, even TB can cause meningitis, so we can use anti-TB medication for that. If it's fungal meningitis, use antifungals. So you treat each depending on the organism that is causing the problem.
Yeah.
But the most common and the most acute are the bacterial meningitis, which Daktari has mentioned. It's going to be the same. The same bacteria in a child, if it will respond to this antibiotic, still responds to the same antibiotic in the adult.
Okay, we're coming back to your feedback and to all your questions, even as we continue this conversation on meningitis. And as we were talking, you spoke about the permanent damage that meningitis untreated can cause. Can we go into that? Because you just kind of highlighted it.
Exactly.
Sure.
Now, of course, the worst permanent damage that meningitis can cause is loss of life. I mean, that is permanent.
Yeah.
So that is the worst thing. And some of them have got a very high mortality rate, even up to 50%.
Wow.
So it's really a serious thing for meningitis. But there are all sorts of other complications that they can have. Being a disease of the nervous system, and you know the brain controls everything with you.
Absolutely.
So it can cause anything. But many people, for example, who have epilepsy, they have it because they had an infection of their meninges and the brain.
As children or as adults?
It can happen at any time.
Okay.
If you get meningitis now and it's pretty bad, you know, it eventually ends up causing even damage to the underlying brain. Although we are saying it's infection of the meninges alone,
Yes.
almost always there will be some inflammation of the underlying brain. That's why there will always be an element of meningoencephalitis, like Dr. said. It's not going to be purely isolated, the meninges alone. So when the brain is going to be affected, then you get no complications for the brain per se. And those complications for the brain per se include seizures, where a person becomes epileptic or gets seizures, include weakness of various forms. You can get weakness of one half, so hemiparesis. It looks like a person had a stroke, but it's just weakness of one side. It can be loss of hearing. It can be loss of vision. It can be loss of, you know, reduction in IQ, developmental difficulties after that, so that the person's IQ becomes a bit less and the person becomes slow. Can be development of fluid in the brain, so you get hydrocephalus, and that has to be removed again later. So all those complications can happen.
Wow. Daktari, a child comes and maybe they've been fighting meningitis, their body has been fighting it for them. What are some of the permanent things that you see maybe? I don't know if you've had a case where someone has had meningitis and you didn't arrest it.
So what happens if somebody presents late and you treat the infection and they survive the infection, but the infection had already progressed by the time they started treatment, they are left with the same, I'm looking for a word, I don't want to say sequelae, the same, the long-term complications. Yeah? The long-term, yeah, that's another one. The long-term complications of meningitis, which can include blindness. Wow. Another one that we didn't mention is, especially with the meningococcal, it can cause loss of limbs, because meningococcal, other than affecting just the meninges, it's actually more like a sepsis. By sepsis, we mean it's a blood, it's throughout the body. So it affects even the blood vessels. So it causes something we call vasculitis. Another word for you. It just means,
I think it's veins.
Exactly. You are so bright. You just need to be given
Where's
a degree.
my biology teacher?
You know, say hi to her or him. So when it causes that inflammation of the blood vessels, and it can cause small clots in the vessels that supply various, maybe the fingers, and you can actually get something we call like gangrene.
Yes.
You don't have blood going.
Yes.
So eventually those limbs have to be cut off. So you've had or maybe have seen some people who have been amputated. But it was as a result of that particular meningitis. So that can be one thing that can go. The thing I want to say, you know, sometimes it all sounds so hopeless but you always need to end everything with hope.
Please.
There's something called rehabilitation. Because as long as somebody is breathing and their brain is working, that person is not lost. They can have rehabilitation of virtually every part. If it's hearing, you can get hearing aids. If it's even that amputation, you can get limbs. They are there. You can get artificial limbs. You can go for something we call occupational therapy. Even in children or even in adults, where you are taught how to relearn your life skills for independence, because the goal is independence. And then the other thing I want to mention, we have children who have learning disabilities as a result of this. But we need to learn to look at children differently. You know, sometimes you want to always focus so much on academics. But there are other skills that the children can learn, even crafting things. If your brain is not wired in an academic way for one reason or another, you can go and learn another skill. And as parents, we need to always focus on maximizing the potential of our children.
Absolutely.
No matter how, because you didn't choose to get that meningitis or encephalitis, it just came. But if the child is alive, now move on from there. Don't despair. There's
Absolutely.
always hope. Yeah.
I think you need a job here because we are Hope TV, where we look and live, and we're all about giving hope and inspiration. When we are back, we are going to continue with how we can prevent ourselves from getting this. Maybe you haven't experienced it, but also we'll be responding to all your questions on Facebook. You can go ahead and comment. You can text in on 22232. We'll also be picking up your calls live in studio. We'll be back shortly. With me in studio, Dr. Kinoti Ndege, neurologist, and Dr. Christine Chege. She is a pediatrician and a pediatric infectious disease specialist. I'm Karika Giri. See you shortly.
Every time, every single minute, there's something new to talk about.
The government continues to make sustained investments.
And we want to completely support and thank our healthcare workers.
Crime rate has dropped drastically.
We are intentional to inform you on stories happening far and wide across the globe from places never imagined.
We shape national discussion as we give you all the perspective to enhance, develop, and better our leadership, right from the national leadership to the tiniest point of administration.
Business remains the engine that makes the world go round. At Hope TV Newswatch, we strive to bring you the market trends as we focus on strategies that make you and your business afloat.
We pay attention, we listen, we observe, we feel, we margin, and we report. From cities all the way to the common Mwananchi, we focus on all you need to know.
Here we transverse the countries to bring you the latest in the world of sports, from scores, fixtures, and breaking news as and when it happens across the globe.
For Hope TV Newswatch, now you know.
Since late last year, the coronavirus COVID-19 has emerged as a serious healthcare threat. This is an infection that has gone global and no one has been spared. The government, through the Ministry of Health, has put in measures to keep Kenyans safe against COVID-19, which is currently rampant around the world, with new confirmed infections and death cases daily. Such sanitization and screening of visitors at this border post and across every entry point in the country is very vital in preventing the spread of the disease in the country.
I'm very happy about the screenings that are going on in Tanzania and Kenya. I think it's very proactive that you're thinking about stopping it at the border so that it does not spread.
It is scary that a single cough here can lead to an outbreak of epic proportions. In order to prevent that, the government has instituted measures to keep Kenyans safe.
The facility has all the equipments you need, from handling a basic patient up to ICU setting.
However, you also have a role to play in preventing spread of infections.
Citizen responsibility is the key to the success of this initiative and these measures. Let's all do what we have to do individually. And this is how we are going to defeat this disease.
It's just our general hygiene, okay? And that now means at workplaces, we should ensure that our work surfaces are clean.
Well, let's ensure that nimefanya proper sanitation ya mikono. Every time na board matatu, lazima ni sanitize mikono.
We have faced many severe challenges as a nation, and we have always found a way to rise above them. COVID-19 is no different, and we will overcome the pandemic. Stop coronavirus. Follow all directives from the Ministry of Health. Wash your hands properly.
Angry president,
yes,
a betrayed deputy president, and a burdened citizen.
The spirit of BBI, we are losing it.
How do we end up with immoral people leading the moral? Candid Talk.
At the core of our being, we are spiritual.
How should the church at this particular time show leadership?
As long as God is not done with us, or He's not pleased with our repentance or our turning to Him, we may still continue suffering the consequences.
Bold approach.
Whatever you bind on earth is bound in heaven. Whatever you loose on earth is loose. Become a son. Your life and your well-being is completely dependent on God and His power.
Spotlight.
Welcome back to Health Check on Home TV, where you look and live. Thank you for choosing to watch us and for being a part of this family as we try to educate ourselves on how we can live better, know our bodies, understand these diseases. Today we talk about meningitis, and with me in studio is Dr. Kinoti, who is a neurologist, and Dr. Christine Chege, who is a pediatrician and a pediatric infectious disease specialist. I wanted to say that from my head. So good. Anyway, as we do that, let's just tell someone who's just joined us what meningitis is, just to refresh, as we get into answering your questions on 22232, and our call line is officially open. So go ahead and you can call in.
So thank you very much, KK, again.
Yes.
Now, as we said earlier, meningitis is a very serious condition.
Very serious.
Where there is inflammation of the lining around the brain, which is called the meninges. That lining also extends down into the spinal cord, and therefore it can easily get inflamed and by various bacteria or various other infective agents like viruses or parasites or fungi. Anything can go in there and cause inflammation. Inflammation, really, to put it simply, is swelling. So in fact, one of the things which happen is that because of all this swelling, the pressure inside there rises a lot. So you get what is called raised intracranial pressure. And that's one of the things you look for when you are trying to
Intracranial. I know the word cranial.
Okay. Cranium for your head.
Yes.
Yes. So you get that kind of thing. And some of the symptoms are going to be either because of that raised pressure, because of the inflammation, or because of the general infection going on in your body.
Yes.
So it can present with headache, with trouble seeing, light, causing a lot of discomfort.
Absolutely.
Vomiting, stiffness in the neck, lethargy, drowsiness. It can cause all that kind of thing. And in extreme conditions, it progresses down to coma. And eventually, if not well treated, it can lead to loss of life.
That's true.
So it is a very serious condition.
Yes. Dr. Christine Chege, you can quickly tell us maybe some of the symptoms that we talked about, some of the things that present, even as someone is joining us now.
Yes. The symptoms are, just think about your brain being a closed, your skull is a closed box, so you have pressure building up in there.
Wow.
So you imagine that headache that you will get. The headache, and then with the headache, because, even the nerves in your eyes are being pressed, you get that, don't want to look at light. You also get things like vomiting. Whenever the pressure, one of the signs of increased pressure in your brain is vomiting. And it's not just any vomiting, it's actually what we call projectile.
Wow.
Ile ya kurusha. Like you will see that guy
projectile
seated there
missile.
at the end.
Yes.
It's a projectile missile
Yes.
of vomit. Yeah. So vomiting, and then of course the fever, because it's an infection. And then now, because if you don't attend to it, and the brain is there being squashed, you'll now go into the lack of consciousness. You first start feeling sleepy, drowsy, confused. You can imagine that brain being squashed. Then lack of consciousness, the unconsciousness, and eventually death. And then something we didn't mention, but we can mention now, we have those nerves that help us with smiling, that help us with keeping our eyes open, that help us with smell.
Yes.
So those nerves, they start, their origins are usually in the brain. So if they are also being pressed, so you find somebody now starting to have funny expressions, because of those nerves being pressed. Yeah, so that is another way, and it can be permanent if not attended to.
That's right. Let's pick a call from Joe in Dagoretti. Good evening. Good evening.
Good evening.
Thank you so much for calling us. What is your question?
My question is there a meningitis which is within 24 hours?
A meningitis which is?
Which kills within 24 hours.
Yes,
the type of meningitis.
Yes, okay, yes. Dr. will talk about it. Thank you for watching.
Okay, thank you.
Thank you so much. That's one of the questions. I think we should pick up another call or we can respond to that.
Yes, indeed. Now, like we said earlier, there's going to be both a classification of acute versus chronic meningitis.
Yes.
So, main acute meningitis are pretty serious.
By acute, what do you mean? Explain to...
Acute is something which comes like a flood.
Yes.
It comes suddenly and overwhelms you.
It was just before dawn. It came out of nowhere.
Yeah, exactly.
Yeah.
It comes suddenly and overwhelms you. It doesn't knock and wait for you for entry.
It just comes in.
It comes in and causes trouble. So acute meningitis, you are previously healthy, minding your business. You start feeling a bit out of shape, out of sorts for 1 or 2 hours. You start developing a headache, which gets rapidly severe. Soon you find you are trying to look at things and you can't see clearly. You might even begin to see what is called a halo around lights. Then you begin to vomit, and within 24 hours you may be gone. So acute meningitis is a killer, and especially the meningococcal type.
Meningococcal type. Doctor, it's something you're saying. Did I cut your thought, or you had expressed everything on the...
On the acute meningitis?
Yes.
It is exactly what he has said.
Absolutely.
Yeah.
Let's talk about the types of meningitis that can be prevented with vaccination.
So there are actually a number.
Yes.
Let's start with the bacterial ones. So bacterial meningitis, we said the two of them, Haemophilus influenza type B, Streptococcus strep pneumo, can be prevented, and the vaccines are available for all children in Kenya.
Yes.
Free of charge.
Absolutely.
So those ones can be prevented. Neisseria meningitis or meningococcal, the one that we said rapidly kills in 24 hours, has an effective vaccine. Unfortunately, you have to pay for that vaccine.
And that's the one then should be free. You understand?
It is
Like,
going
that's
to
the
be
one-
free, but
Okay.
it is not yet free, unfortunately.
Okay. Thanks for the
But
leakage.
like I said, we are a hustler nation.
Yes.
We listen when we are told things. We can save up for this vaccine.
We can.
It is available in private hospitals, in faith-based hospitals. You can actually go and get it at any age from 10 months on. You
Okay.
can get that. Then the other meningitis that is preventable largely is the one by tuberculosis. We all got the BCG vaccine. The BCG vaccine protects against TB and the various forms of TB. You know, we always think TB ni ya kifua.
Yeah.
It is not 100% effective, but against meningitis, it is a bit more protective than against the TB ya kifua.
Okay.
So at least if you have that vaccine, you are, especially for babies, because TB meningitis in babies is very, very bad and very difficult to diagnose. So at least for them, they are protected. Unfortunately, for the adults, it's not very protective because the immunity wanes off over time. So those types of meningitis can be prevented with vaccines. And then the other way you can protect yourself from meningitis, if you can, is avoiding overcrowding. You don't be in places where you don't have to be.
Absolutely.
Yeah, and then you don't, ukisikia kuna mtu alikufa of meningitis in your hostel, in your dorm, please go and see the doctor because you can be given some antibiotics to protect you from, even if you are just a contact, you are not maybe already sick, but if you take antibiotics as a precaution, because you had been exposed to somebody who was confirmed to have meningitis, then you can be protected and of course get the vaccine.
Absolutely. We're going to talk about prevention just in general as we continue, but you preempted this and someone asked on 22232, which is our text line. Go ahead and text us, asking, can adults be vaccinated against meningitis?
Yes, indeed, they can be vaccinated, and especially the high-risk groups. The high-risk groups are people with various forms of immunosuppression, people with various chronic conditions like kidney failure or other chronic conditions like that, and even the elderly. You know, meningitis has got 2 age groups which are really targeted by age a
Sure,
lot.
yes.
That's going to be the under 5s and the above 60s. So those two...
all the ones who have been told not to go to church. Since now churches are open. It's actually under 13, right? Yeah, and over 58.
Yes.
Yes.
So anyone who is within a high-risk group, is vaccination is always recommended for those people as adults.
Okay.
Yes.
So definitely you can get this. And Daktari, as we've been talking, by the way, if you missed this part, we talked about the importance of getting vaccinated and actually protecting yourself from diseases that you could actually avoid getting. As we continue with that, I think this one is still for you, but you can also chime in. Dr. Christine Chege, is treatment for migraines is symptomatic. In your experience, do you have people cured from migraine?
Now, migraine is largely by now known to be a largely genetic kind of condition.
Oh, really?
Yeah, there are some genes which have been identified which are responsible for migraine.
Wow.
So that's why you find it even being common in various families. You find the mother has migraine and someone else has migraine in the family. So such conditions are very difficult to cure completely because you cannot treat them once and for all and say, now I declare you cured.
Okay.
So the treatment is going to be to control the situation. So a patient will need to be on medication on and off for a long time.
Yes.
But the best thing for migraine is because there are various things called triggers, which trigger the attack. If the patient identifies these triggers, maybe it might be stress, some talk about being in the hot sun, various foods, various alcoholic drinks, various things. If the person is able to identify what is their trigger, and then they avoid that trigger, then they can reduce the frequency of attacks that comes. That will mean that they will not have to take medication as much as they would have taken if they were not if they didn't identify their own trigger.
Okay. Okay, we're welcoming all your calls on the show right now. You can call. The number is right below the screen. Looking forward to responding to everything you have, or also go ahead and text us on 22232. We'll be continuing with your questions. But we were talking about prevention, and that's one of the highlights. I didn't know that if someone in your family dies of meningitis, you lived together, you must get to see a doctor and get some form of medication. What other ways can we prevent?
Yes, that is contact prophylaxis, where if you have been in contact with this kind of infection, the thing is that even people are carriers.
Yes.
You might have the bacteria in your nose just living there. So sometimes people are swabbed. If, say, for example, if you work in a hospital or children in the school or something, there's been an outbreak, they may not have any symptoms at all. But you go and pick up swabs just like people are doing for COVID, though the COVID one goes all the way to the back of the throat. You swab the noses, and you might find that they are carrying some of these bacteria. So then treatment can be offered to eliminate these bacteria from the system. So for people who are contacts, or if you've been in an environment where there has been an outbreak, then it will be useful to do that so that you get the outbreak can stop. So Dr. has talked about vaccination, which is really key in management of the condition. Another thing which might help with the prevention is managing the environment. We know that infections are basically spread from person to person. They are easily spread where the environment is conducive for spreading, where the environment is not clean, the surfaces are not very clean, where people don't have good water supply. These things are common, say, for example, in the informal settlements. Because in the informal settlements, the water supply is not good, the toilet, waste disposal is not good. All these things is not. Ventilation, so many people within one room. So part of the prevention for this thing is actually economic, socio-economic. So that when you improve the nation's socio-economic status, then very few people will be living in crowded accommodation, more people will have water supply, more people will have proper waste disposal, and therefore all these infectious conditions will be much less than they are right now.
Absolutely. Doctor, do you want to add something else, especially around the children?
Well, around the children, I think basically when we talk about vaccination, and then of course breastfeeding, never forget breastfeeding. Breastfeeding is free and one of the most effective ways of giving a baby immunization through the mother's what we call antibodies for the first year of life, because some vaccines you'll get later on. But the mother will give you some form of protection through her breast milk. So breastfeeding is one way of protecting babies. Other than that is where your babies don't have to be, don't take them.
Absolutely.
Yeah.
Yeah. You also highlighted on when, you have issues in your genitals.
Oh,
and,
yes.
maybe you don't get that checked in time and you're pregnant or you're going to be giving birth. Just encourage someone who's watching on the importance of taking care.
Yeah, we talked about the type of meningoencephalitis. When I say meningoencephalitis, I mean inflammation of both the brain and the coverings, what we call meningoencephalitis. Encephalitis standing for brain inflammation. So that one, the commonest cause is herpes simplex virus, of which we have 2 types.
Yes.
We have type 1, which is that one that causes the cold sore. You know that kidonda you have when you're on your
The
corner
really
of the
ugly
lip.
one, yes.
It can cause, when it gets inflamed, maybe in a person whose immune system is not very good, can cause a meningoencephalitis. Now, however, we have the type 2, which is the genital herpes. So genital herpes can cause meningitis in babies if babies get into contact with the viruses when they are passing through the birth canal. They can get now infected with those HSV type 2, and then now subsequently go to get meningoencephalitis. So for pregnant mothers, it's very important if you have such an infection in your genital area, like some of those pimples that look like herpes, please go and get checked. And if it is too close to delivery, you'll be advised to deliver via cesarean section.
Wow.
So that your baby doesn't have to pass through the birth canal, but can be born the other way.
Question on 22232. Can all types of meningitis be prevented with vaccination?
I think we've answered that. But again,
Yeah.
not all types.
Can be prevented with vaccination?
Not all.
Okay.
Yeah.
Okay. I think we had talked about it within the break, and one was texting in just to ask that question. Thank you so much for keeping your texts coming on 22232. Are there any lifestyle things that one can adjust, maybe to avoid meningitis, even as we're talking about prevention?
That is important because I always believe that prevention is always going to be better than curing.
Absolutely.
So if there's any way of managing a disease before it gets to you, that will be vital. Now, well, it's environmental part of it, in the sense that, these infectious diseases pass from person to person. So having a healthy lifestyle in the sense of being aware of your hygiene, hand washing, sanitizing, avoiding very close contact, avoid unnecessary, say, for example, kissing or shaking hands or anything.
Shaking hands should be illegal.
It should be illegal.
I agree.
Where you're in very close contact with people who may potentially be infected. That is one thing. So that's a thing which a person can consciously make a decision that I will change my lifestyle in the sense that I will obey all the rules I will observe, not obey, but observe all the rules of hygiene and a clean environment. The second one is larger in the sense of as a community or even as a nation.
Yes.
How to make sure that people have got proper housing, proper food, spaces for exercise, and encouraging to have exercise. All those things which give rise to a healthy body.
Okay.
Exercise, food, enough rest, and that kind of thing. Then finally, people also need to make sure the immunity is strong, because sometimes you're able to fight these infections. Or if you don't fight it, at least even if it gets you, it probably won't be as serious as a person who was extremely weak.
That's true.
So there are measures a person can observe to make sure that the immunity is good. There are many things which reduce the immunity. Of course, everyone knows about immunosuppression by HIV, but that's not the only thing. Having any chronic condition, having chronic kidney disease, having chronic liver disease, having poorly controlled diabetes, anything will reduce the immunity. Even lack of exercise, stress, insufficient sleep, all those things will make your immunity.
Especially for the young adults with the insufficient sleep.
Insufficient sleep.
Because of phones.
Exactly.
Internet.
And then you find things like smoking. Smoking reduces the immunity around your airway, and therefore bugs can easily get into your system. Excessive use of alcohol, all those things will reduce your immunity and make your body unable to fight off infections.
Okay.
So a person interested in a healthy lifestyle is advised to observe all those things in addition to the basic hygiene measures we described earlier.
Absolutely. Dr. Christine, I want you to just talk about what we eat and what we put into our mouths, because clearly, as he's talking about lifestyle and being able to fight and boost our immunity, what can you highlight on that?
What I can highlight is that let's keep it very simple. Let us stop having food fads. You know, this juicing and smoothies and I don't know what other things. Please just take the food in its natural form. And I don't see why you should eat sukuma wiki juice. I mean, why would you want to take sukuma wiki juice? Yet you can take the sukuma wiki with the fiber which you need, because the fiber you need it to help you with your digestion and to feed the good bacteria that you have. You know, we have good bacteria in our system that feed on that fiber that you are throwing away with the juicer. Just a rule of thumb, which I say, and maybe I tell this to mothers because they are my clients. The more color you have on your plate, the more likely you are to be eating a healthy diet. If you have got red, orange, green, brown, and white. Yellow. That diet is balanced. And the same for your baby. The other thing we'll talk about is portions. So just a rule of thumb is a portion. Well, for children, this may not apply very much. But just try and eat a lot of vegetables. A lot of vegetables. And then the rest, a bit of starch and a bit of... But nothing should be off limits. Because if you read the internet... Today this is in, tomorrow that is out.
I know.
Just balance
like
your diet.
Like there was this ketosis season where everyone was not touching any carbs.
Yes, leave those fat diets out.
Okay.
They are not even affordable and they are wasteful. They are wasteful, they are a waste of time. You will find somebody is very busy taking sukuma wiki juice and paying for the gym, yet perhaps you can walk, you know.
Yeah, so no more driving to the gym.
You can do housework, but you'll go and fill yourself with burgers in the house and sit down to be served because you've come from the gym and you've drank sukuma wiki juice, so you feel like you're very well covered.
Hey, there's someone who has been targeted. Sorry, keep watching Hope TV.
No, stop drinking sukuma wiki juice.
So let's take care of our health. And also, I like that doing housework is actually a form of exercise.
Yes.
We can take that up. Our calls are open to you. We have about 10 minutes to answer all your questions on our call line. Our call line is right below the screen. The conversation is on meningitis and its treatment, its prevention, its causes. Did we talk about any surgical procedures to cure meningitis or to treat?
Well, surgery is not routinely employed in the treatment of meningitis, but when complications arise, then you might need some surgical procedures.
Okay.
And one that I can think about is, we talked earlier about a condition called hydrocephalus, where you get blockage of the normal flow of the fluid we are talking about, and because of this blockage, the fluid accumulates in the brain.
Oh.
And when that happens, the brain really gets squashed by this fluid. And it's a condition where people are told they have water in the head.
Can you tell externally? Can you see it externally or it's...
In children,
yes.
You might tell.
The head will start growing big.
Okay.
Yes.
Yeah.
Because the muscles are not yet...
The bones are not fused.
Yes.
Yes.
The cranium.
Yes.
Just hire me.
You're halfway there. Excellent. So you can't tell it in children. And in fact, some children stay with it for such a long time that you really get them with really big heads. And it becomes very difficult for them. In adults, once the cranium has fused, then you can't tell from a distance.
Yes.
But you need to do a scan of the brain, of the head, and you find this enlargement of these fluid-filled spaces. And therefore, there's hydrocephalus. That one, the only way to clear it is by tapping that fluid out. So the surgeons will insert a tube here, and they will burrow it through the skin into the abdomen. So the fluid will be continuously shunted, removed from the head into the abdomen.
Okay.
So that is one thing which can be done.
Into the abdomen?
Yes, and then it's just recirculated.
So, you just don't remove it?
No,
because you need it.
You need it, and if you remove it, it means it will be exposed to the environment, and therefore germs can enter through the open end.
Yeah. Wow.
So it's got to be closed on both ends inside your body.
Okay.
So that is one surgical procedure which can be done for this. But the bulk, of course, there may be surgery for other complications if the patient was in ICU and got bed sores, but that is really not meningitis per se. That is surgery for other complications for it. If a person maybe has an abscess, because say, for example, if you have an abscess on your head.
What is an abscess?
An abscess,
just
like
for
a
someone
boil.
Who doesn't know.
A
Okay.
boil. If you have a boil, let's call it a boil, but an abscess can even be very large.
Okay.
An accumulation of pus. If you have this accumulation of pus around your ears, sometimes around your nose, or some infections in the sinuses, which are just next to the nose.
Yes.
Maybe some people with blocked nose might be having some trouble with their sinuses.
Oh, by the way, to
Yes.
interrupt, we forgot one cause of meningitis
Which
can
one?
be untreated sinus infections. Not sinus allergy. I'm not talking of sinus allergy. I'm talking
Sinus
of
infection.
sinuses are those spaces in your skull. You
Yes.
know the skull is not a solid bone.
Yes.
If you get infected sinuses where the manifestations are basically headache, the same as not wanting to look at light,
irritation.
and they get very serious. They can actually, because they are very close to the meninges, you can actually get meningitis, or even ear infections. You can actually get meningitis if you stay for long without treating your ear infections, especially in children.
Wow.
Yeah, that's something we didn't
That's
highlight.
something that's not mentioned.
Yeah.
Yes, exactly. So those conditions sometimes are treated surgically. The ENT surgeon will go in and clean up the sinuses and remove the pus from there, or even from the bones in the ear. So that can be a surgical possibility of helping manage meningitis.
Okay, absolutely. One is asking on 22232, and thank you for texting in. Please leave your name so that we can acknowledge you. Asking how long does it take to develop? And I think we had talked about acute and chronic, but one is asking how long?
How long does meningitis take to develop? We said that meningitis can be, let's talk about the acute meningitis,
Yes.
because it is the one that is very, very serious
Yes.
and easy to miss. The symptoms that come in early cannot be distinguished from just a bad flu. You basically start feeling tired, under the weather. But unlike a flu, a flu, you'll start getting a runny nose,
At least
and
a
then
cough,
the
maybe.
headache is just there, nothing too serious. You respond to painkillers, you will cough, and then you basically feel very bad, but on a status quo. But now meningitis is progressive. So once you start feeling that way, what we've said, it rapidly progresses. The headache becomes severer. The light perception and the vomiting. By the time you get there, please be talking about it when you're in the hospital. Be in the hospital, because now at that point, the doctor will definitely be able to see a stiff neck. By the time you're having that severe headache, the doctor will basically be able to pick that up.
Okay.
So don't wait.
Yes.
So it progresses. It can progress from early infection to death within 24 hours.
Yes.
But if caught early, remember we said it responds to antibiotics.
And penicillin. That's what we
Penicillin
talked about,
and
yeah.
other of the similar class,
Yeah.
which are available in every hospital. Yeah.
Let's talk about the pain levels, because really, I mean, when I say I'm in pain and someone else is feeling the same amount of pain or discomfort, it's different.
It's different.
So is there any other distinction? There are people with lesser pain levels, apparently.
Yeah.
So me nitadungwa hivi nipige nduru.
Yeah.
It's like the whole place is on fire.
Yeah.
Someone is like, ouch.
Yeah, that is actually a very insightful comment.
Yeah.
Because pain is not just pain. Although we define it as the experience you get when there is noxious stimulus that has got the potential to cause tissue damage. But pain also has a psychological component.
Yeah.
And I always tell people to do an experiment where you pinch yourself as hard as you can. You do that, but you're not really feeling so much pain when you pinch yourself. But if I pinch you as hard as I can, you'll start screaming within a few seconds of it. And why is it that when you pinch yourself as hard as you can, you don't really feel that much of pain, but when somebody else pinches you, you feel that pain? It's because you don't know the intentions of the other person. So there's a psychological component
there's a
to
fight
it.
or flight.
Exactly. So there's this psychological component which interprets how you view the feeling that's coming from your skin.
Okay.
Just like, say, for example, people use drugs. You find someone getting a syringe and needle and putting it there and injecting with no problem at all. They don't feel pain. But the same person with their doctor or a nurse putting the needle in them, they'll run away.
Drama.
So there's that psychological thing to it, and there's also the actual damage to the body from the pain.
Okay.
But one way that we try to see if you can be able to gauge the extent of pain is by giving people a scale maybe of 1 to 10, where 10 is the most severe pain the person has ever experienced, and 1 is a very mild pain, which is just the beginning of pain. So you ask them to say, on a scale of 1 to 10, where do you think your pain might be?
Mine is always 10.
No, they will say, they will definitely not, even children. For children, we use faces, where smiley faces, where the smiley is, I'm not feeling pain. Then there is the one at the end here, the 10, where they have the tears running down their faces.
Okay.
So that helps, but you don't always get, of course, a truthful answer. Maybe not truthful, but you don't always get the answer you're expecting. Because people have got different perceptions. People are different.
Okay. Elizabeth in Githurai, good evening. Good evening, Elizabeth.
Good evening to you. How are you?
Fine, thank you. Thank you for watching Health Check. What's your question?
Now, my question is, and I'm going to ask it in Kiswahili, so
uliza na Kiswahili ni sawa. Tunaelewa.
Sasa daktari, nimeshukuru sana kwa hicho kipindi. Maana shida yangu kubwa ni headache. Si headache ati venye unasemanga naumwa na kichwa. Yaani hapa katikati nasikia uchungu, yani ukifinya ndani ni kama ambaye uchungu uko ndani kama ambaye kuna shimo pale. And nikikunywa painkiller like Panadol inaisha. Na imekuwa hapa for like a week now. So I don't know hiyo ni shida gani, maana kuna siku nilienda kwa daktari akaniambia unaweza kupimwe BP, pressure, alafu unaweza kama shida inaendelea upigwe picha ya kichwa. Sasa sababu ya kimapato na vile kulikuanga na corona hizi, sasa sikuweza kwenda kwa hospitali. So I've been maintaining it with the Panadol.
Do you have a follow-up question for her?
No, maybe I just try to answer.
Okay, asante sana. We'll respond to you. And sorry, I hope you get better soon.
Sawa, thank you. Thank you.
Yes, you can respond to.
Pole sana kwa headache na asante sana kwa swali lako. Now, headache ziko aina nyingi. Na mtu anaweza kuwa amekuwa akiumwa na kichwa kwa ile inakuja inarudi miaka na inakuja inarudi. Hiyo kama ni ile headache umezoea, hiyo sio serious kwa sababu ni kitu ambao unajua tayari sio kitu ambayo inaweza kukuweka chini mara moja.
Absolutely.
Lakini pia kuna headache nyingine ambayo tunaweza sema ni headache ambayo imeanza juzi, ambayo haujaipata. So kwa kimombo mtu anaweza sema new onset headache.
Yes.
Meaning that haukuwa na headache zamani, ulikuwa sawa, ama ulikuwa na headache type zingine kama migraine ama headache zingine, lakini umepata hii mpya ambayo haujui ni nini. So mtu akipata headache mpya ambayo hajui ni nini, hujui. So inaweza kuwa ni kitu serious. Inaweza kuwa pengine hata unapata growth kwa kichwa, hata kama sitaki kushtua mgonjwa yule ametupigia. Lakini sio, inaweza kuwa kitu serious kwa sababu ni headache mpya ambayo haukuwa nayo zamani. Inaweza kuwa ni infection hata kwa sinuses zile tumekuwa tukisema saa hizi. Inaweza kuwa ni stress sababu ya corona, pengine kazi imeenda chini. Inaweza kuwa ni anything. So really sio rahisi kusema ni nini kwa televisheni. So ingekuwa vizuri kwa akijaribu tu hata kama mapato yako chini. Unajua mapato yanaweza kuwa ni chini, lakini maisha yako tena nayo inaweza kuwa hatarini.
That's true.
So afadhali ajaribu, aende kwa daktari, angaliwe vizuri, pengine anaweza hitaji hata kufanyia picha ya kichwa, alafu aambiwe ni shida gani imetokea. So ni vizuri, watu wengi saa hizi mambo sio rahisi sababu uchumi umeenda chini. Unajua economy ilikuwa imefungwa kwa miezi kadhaa. So kazi nyingi zimeenda chini. Lakini still afadhali ukuwe na afya nzuri badala ya ujali pesa sana. So uende tu kwa daktari akuangalie.
Ningesema because nilisikia kama she is scared of corona going to hospital. But the hospitals tuna take precautions.
Everything is sanitized.
Tunavaa masks. Unaona mimi na daktari tumevaa masks. Tunavaa masks. Tuna social distance. Kama ni waiting room tunapanga watu. So hata kama ni hospitali ya serikali aende tu. And I hope ako na NHIF. Because NHIF itamsaidia hata kama ni hiyo picha ya kichwa
cover some cost
atapigwa.
Absolutely.
Na at least kwa hospitali hata kama ni za county ataona daktari, ziko na madaktari. So asiogope ati aende hizi private za huku. You know some of the private hospitals si za madaktari. Hata hivyo hizo ziko ndani kwa estate. Hizo pengine si hospitali za ukweli.
It's business.
Ni ukweli. Na wacha tuseme tu aende tu kwa hospitali hata kama ni Kiambu ama KU, si yako Githurai, aende tu hospitali ya serikali.
Okay. Sorry, Peterson, you can call back again, even as we will respond to you in a short while. Our call line is open. We have about 5 minutes now for all your questions on our call line. It is open, the conversation on meningitis. And one asking here, they can't smell and they're feeling pain in their nose. So maybe when you mentioned sinuses, people think sinuses ni wapua. I don't know. What can you comment for them?
Okay, that is also quite a broad question.
It is, absolutely.
Of course, it can range from the alarming, because one of the earliest signs of COVID infection is loss of smell. So it has been mentioned several times as, but I'm not saying our patient or our caller has COVID-19. No, I'm not saying that. But I'm saying it can be anything, including any inflammation within the nose, including exposure to strong smells which damage your sense of smell, including a normal cold, which is damaging that area. So there are many possibilities.
Okay.
So I think one answer which might answer all the questions is this. If you develop something that you are not sure, you've never had it before, you've got a new thing that you don't understand what is coming from, have it checked by someone.
Please.
Then once you are told, no, this is not serious, just relax, then you know that is it. But if it's something you've been having before, if you've been having loss of smell every now and then when you have a cold, since you are a little person used to have this kind of thing, you know it, you understand it, don't spend your money going to hospital because maybe it's the same thing you've been having all the time. But if you get a new thing that you don't understand, don't even call, just go to hospital.
Wow, I think what I don't really understand with us and just being Kenyan is waiting for the disease to be so bad. I mean, staying with a certain pain or discomfort. I mean, for such a long period of time, and it might be a source of resource or something going on. I think even if you can, just walk into the doctor, ask him, please check my brain. Is my brain okay? We'll go, if you're able to do it. Dennis, good evening. Dennis, thank you for calling Hope TV. Dennis?
Yeah,
How are you?
I'm fine.
Go ahead and ask your question.
Yes?
Ask your question. Uliza swali tafadhali.
Kujaona. Mimi ndio nimeingia saa hii.
Umeingia sahi, karibu.
Na nimeingia saa hii. Na hiyo kitu ndio nimeingia saa hii nimeona sio iko sawa.
Asante.
Na nataka kitu mnifafanulie tu vizuri, naona ni mzuri.
Okay, asante sana. Okay, thank you. Wow, that's nice. Okay, so Liz is saying, when I'm sleeping, my head beats like a heart. And the doctor said it's because of acid. Can this be another sickness? Any of you can respond.
Can I allowed to laugh?
No.
Not to laugh because
Well, it's difficult to resist, but we should not laugh.
Like we should not laugh.
No. I'm trying to see the connection between the heart and the acid.
Yeah, acid and the pounding in your head. That sounds a bit far-fetched.
Okay.
I've not really had anyone in my experience who has had acid until it caused pounding in their head, like their heart is beating.
Yeah.
That is actually a condition called pulsatile tinnitus.
Let me not try. It's
Pulsatile tinnitus, where you hear sounds like your heart is beating inside your head.
Yes.
That could be potentially something serious.
Yes.
You might have something like an aneurysm in your head, you know, where the blood vessel balloons out like that, and it's pulsating like that.
Wow.
You might have pressure elevated inside your head. So it's not a very common symptom. When you get such a thing, please go to hospital quickly.
Tafadhali, can you tell her where to go to hospital? Maybe she can visit you. Just refer her somewhere, please.
Yes, I think, I don't know where she lives, but she needs to go to the nearest hospital that is of good quality near her, and she can get a referral. If she's in Nairobi, she's very welcome to visit us.
Yes, ask where. You know, they don't know.
Oh, my office is at a building called Fortis Suites.
Fortis Suites.
It's on Hospital Road, just before you get to Kenyatta National Hospital. And once you're in Fortis Suites on the 5th floor, you'll find my office over there.
We're wrapping up. That's why I'm asking. And where can we find you, Dr. Christine Chege?
I can be found at Aga Khan University Hospital. Yeah.
That's where we can find you. Yes. Absolutely. Good stuff. Even as we do that, we're giving our last remarks. This conversation has been on meningitis. Kama ulichelewa kama Dan, go ahead and watch the video. It's going to be up on YouTube as soon as we're done. And we have our Facebook video, so you can go and catch yourself up on what you need to do. Just in, I think, 2 minutes each. Go ahead and wrap up. What can you say just to advise someone who's watching on how to be more careful or whatever?
I think my words would be that meningitis is an infectious condition.
Yes.
It's an infectious disease.
Mhm.
And unfortunately, in this part of the world, we are suffering a lot from the burden of infectious diseases. In the West, they have been suffering from NCDs and other chronic illnesses.
What is NCDs?
Non-communicable
Yes,
diseases.
I knew that.
Now, but here, we have got those, but we also have the burden of infectious disease.
Absolutely.
Now, infectious disease can be managed by what we mentioned earlier, personal responsibility, making sure that your environment is clean, you observe all the rules of hygiene, but they also need further action, where we ensure that the population has got better housing, better food, better exercise facilities. We should not make estates where people have no place to go and play or walk or run or jog. We should not do that. We should make sure roads are built with a jogging path on the side so that people can exercise that way. And also the environment is improved for people in the informal settlements so that they have good access to enough space, ventilation in the house, enough space, and appropriate sanitation, as well as food and time to rest and so on and so on. So if we do that, we can really reduce our burden of infectious conditions in this country as much as possible. And then we'll be left fighting with the oncoming lifestyle and other conditions which are coming in.
Absolutely.
So everyone needs to take this seriously, and because it's not just going to be one person. Remember, we said meningitis is a thing which can occur in outbreaks, cause epidemics, infect the whole society. So if one person has meningitis, it's not a problem for that one person.
No.
It's a problem for the society. So everybody needs to come in together and work to both sensitize people about it and also improve the living conditions of the whole society as a whole.
Absolutely. If you know better, you do better. Dr. Christine, as you wrap up with your final words.
Okay, for me, being a pediatrician, I always speak about vaccination. If a pediatrician who does not speak about vaccination will really be doing a disservice. So let us vaccinate our children. In these times of COVID, people are not bringing their children for vaccination. And unfortunately, we may be protected for some time because we have this thing called herd immunity. What does herd immunity mean? Herd immunity means just the same, the thing herd. Herd means a flock of animals.
Oh, herd.
Oh, sorry.
Sorry.
Yes.
Could have had young
No, I'm from Nyeri, so I say
Sorry.
herd. But for you,
It's okay.
Kerry,
I know, it's okay.
herd. So herd immunity is where in a group of a population, a certain number is protected.
Yes.
So they end up protecting the ones who are not yet vaccinated.
Wow.
But if you stay for a certain period of time, the herd immunity will wear off because we are not taking our children for vaccination, and we are going to see the rise of these infections that we have managed to control, like the strep pneumo, the H influenza type B that cause meningitis. So let's not be afraid of corona to the extent that we are willing to overlook the very serious infection. So let's take our children for vaccination on time. The other thing is let us, as much as possible, especially for the mothers, sometimes we want to really go out there and make money. And sometimes it doesn't even make sense to leave your baby at home. You're a very small infant who is breastfeeding. You wean them so early. You leave them under the care, maybe in an informal daycare, where they are exposed to so many children, and they end up getting some of these infections because you want to go and earn a little bit of money. It is better even you sacrifice a bit. And if it is even possible, and you really feel that, oh, I have to leave my baby and leave your baby with the grandparent or with the mom, and don't take your baby to these very informal daycare centers because that's where they are catching a lot of infections because, first of all, they are not even taken out to the sun. Babies need sun for vitamin D. Vitamin D is very useful for immunity. Babies need vitamin D. So let us look into that. And I'm very, very sure if we do those two things, vaccination, breastfeeding, and proper handling of babies, we will have done a lot.
Absolutely.
Yeah.
Thank you so much. Thank you so much, first of all, for making time to come. I mean, you could be doing many other things, but you've come to have this conversation with us. We really appreciate you. And for you, for watching Health Check on Hope TV, where you look and live, remember to share this video. Remember to like and subscribe to our YouTube channel. That's Hope TV Kenya. We'll be seeing you next week with greater conversations right here. Even as we do that, share. Did I say share? Share, share, and share. I'll see you tomorrow. at 5 a.m. on Hope FM, where you listen and live for Activate. Until then, bye. Thank you.